Let me ask you something. If I told you there's a food sitting in your grocery store right now, cheap, unglamorous, completely legal, that has real research behind it for supporting prostate health, would you want to know what it is? Most men over 50 are dealing with some version of the same frustrating symptoms. Getting up 2, 3 times a night to urinate, a weaker stream than you remember having. That nagging feeling that you didn't quite empty your bladder. And most men assume this is just an unavoidable part of aging, something you quietly live with, or something that eventually requires medication or surgery. I'm Dr. Emily Carter, and in my years as a urologist, I've seen an enormous amount of unnecessary suffering around prostate health, largely because men either don't know or were never told about simple interventions that have genuine research behind them. Today, I want to talk about one specific nut that keeps showing up in prostate health research, why it may help, what the actual evidence says, and importantly, what it can't do, because I never want to oversell something in this space. Before we get into it, if you want more of these honest research-backed conversations, hit subscribe and drop a comment letting me know if you've dealt with prostate symptoms yourself. You're far from alone. Let's get into it. Before I get to the nut itself, I want you to understand what's actually happening inside your body because it makes everything that follows make sense. The prostate is a small gland, roughly the size of a walnut, ironically enough, sitting just below the bladder as men age. It's extremely common for the prostate to gradually enlarge, a condition called benign prostatic hyperplasia or BPH. It's not cancer. It's simply a size increase that happens to the vast majority of men eventually, often starting in their 40s and becoming quite common by their 60s and 70s. The problem is location. The prostate wraps around the urethra. The tube urine passes through. So when the prostate enlarges, it squeezes that tube and everything downstream gets affected. Weaker stream, more frequent trips to the bathroom, especially at night, a sense of incomplete emptying, sometimes urgency that comes on suddenly. Inflammation plays a significant role in this process too. Chronic low-grade inflammation in prostate tissue is now understood to contribute meaningfully to both the enlargement itself and the severity of symptoms. This is exactly where certain foods, including the one I want to talk about, come into the picture, because some of what we eat has measurable anti-inflammatory properties that appear to specifically benefit this tissue. I think it's worth pausing here because so many of my patients arrive at this conversation feeling like their body has betrayed them somehow, like this is a sign of decline they can't do anything about. That framing isn't accurate, and it isn't helpful. BPH is common, but common doesn't mean untouchable. The tissue is still responsive to what you feed it, how active you are, and how much inflammation you're carrying elsewhere in your body. That responsiveness is exactly why diet has a real seat at this table, not as a replacement for medicine, but as a genuine lever you can pull. The nut I'm talking about, and I use that term loosely since it's technically a seed, is the pumpkin seed. Pumpkin seeds have quietly built up a genuinely interesting body of research when it comes to prostate health, and it's worth understanding why. They're extremely rich in zinc, a mineral that prostate tissue concentrates more heavily than almost any other tissue in the body. Several studies have found that men with BPH and prostate-related symptoms tend to have notably lower zinc levels in their prostate tissue compared to men without those symptoms. Zinc appears to play a direct role in regulating hormone activity within the prostate, specifically limiting the conversion of testosterone into a more potent hormone called DHT, which is heavily implicated in prostate enlargement. Beyond zinc, pumpkin seeds contain high levels of phytosterols, plant compounds that have been studied specifically for their impact on urinary symptoms related to BPH. Several clinical trials looking at pumpkin seed extract found meaningful improvement in urinary symptom scores, things like frequency, stream strength, and nighttime urination compared to placebo groups. One trial following men over multiple months found a significant reduction in self-reported symptom severity in the group taking concentrated pumpkin seed extract. They're also rich in omega-3 fatty acids and antioxidants, both of which contribute to reducing the chronic inflammation I mentioned earlier. It's rare to find a single food that touches this many relevant mechanisms at once: hormone regulation, direct nutrient supplementation, and inflammation reduction. What I find genuinely compelling about this particular research thread is how it converges from a few completely different angles and still points the same direction. Population studies looking at men with diets naturally higher in seeds and nuts tend to show lower rates of significant BPH symptoms. Laboratory research on prostate tissue shows plausible mechanisms for why zinc and phytosterols specifically would matter. And controlled clinical trials, the gold standard for this kind of question, show measurable symptom improvement over placebo. When epidemiology, mechanism, and clinical trial data all point the same direction, that's usually when I start taking a natural intervention seriously with my own patients rather than treating it as another wellness trend. I always tell my patients that whole pumpkin seeds, the raw or lightly roasted, unsalted kind, are a completely reasonable place to start. A small handful, roughly an ounce, daily is a common target used in a lot of the observational research. They're easy to add to a salad, oatmeal, or just eaten on their own as a snack. For men with more significant symptoms, concentrated pumpkin seed extract, available as a supplement, is what most of the clinical trials actually used, since getting a therapeutic dose purely from whole seeds would require eating a fairly large quantity daily. If you're considering a supplement route, look for products that specify the concentration of phytosterols, and I'd always recommend discussing it with your doctor first, particularly if you're on other medications, since some interactions are possible. One thing I always clarify for patients is that roasted, heavily salted pumpkin seeds from a gas station snack aisle are not really the same product referenced in this research. Excess sodium works against you if you're already dealing with urinary frequency and any degree of blood pressure concern, which many men in this age group are. Raw or dry roasted, unsalted seeds or a reputable extract supplement are what actually reflects the studied intervention. It's a small distinction, but it matters because I've had patients genuinely believe they were doing themselves a favor eating a heavily processed salted version and wonder why they weren't seeing any benefit. I had a patient in his early 60s who came in frustrated, getting up 3 or 4 times a night, exhausted and hesitant to start on prescription medication because of some of the side effects he'd read about. We talked through his diet, and pumpkin seeds came up as a low-risk starting point. He began having a small handful daily and added a concentrated extract supplement after checking with me about his other medications. Over about 3 months, his nighttime bathroom trips dropped from 4 to 1 or 2 most nights. Not a total cure, but a meaningful, measurable improvement in his quality of life from something sitting on a grocery store shelf. Another patient of mine, a retired firefighter in his early 70s, had been managing mild BPH symptoms for years and was skeptical of anything that didn't come with a prescription label. He agreed to try it mostly to humor me, and largely because he didn't want to start a new medication yet. He tracked his symptoms fairly meticulously, being the detail-oriented type, and came back after 2 months, genuinely surprised at how much his stream strength had improved. He told me it wasn't dramatic, but it was the first improvement he'd noticed in years without side effects to weigh against it. That's usually the most honest way to describe what this intervention offers. Modest, real, low-risk improvement, not a miracle. Now here's the part I think is genuinely important, and something you won't hear from every corner of the internet. Pumpkin seeds are not a cure for an enlarged prostate, and they are absolutely not a substitute for actual prostate cancer screening. I've had patients come in having read about pumpkin seeds online and assume that because they'd started eating them regularly, they no longer needed their annual PSA test or prostate exam. That's a dangerous assumption, and I want to be very clear about it here. Nutritional interventions like this can meaningfully support prostate health and reduce BPH-related symptoms for a lot of men. They do not replace screening for prostate cancer, which remains one of the most common cancers in men and is highly treatable when caught early. If you're experiencing significant symptoms, blood in your urine, severe pain, sudden inability to urinate at all, those require immediate medical attention, not a dietary adjustment. Pumpkin seeds are a legitimate, evidence-supported piece of a broader approach to prostate health. They are not a replacement for actual medical care, and any resource telling you otherwise isn't being honest with you. I want to be equally direct about something else. If your symptoms are already severe, waking up 5 or 6 times a night, significant pain, or a stream that's become extremely weak, pumpkin seeds are not going to be a strong enough intervention on their own, and waiting on dietary changes to work before seeing a specialist can genuinely cost you time you don't need to lose. This kind of natural approach fits best for mild to moderate symptoms or as a complementary addition alongside whatever your doctor has already recommended, not as a way to avoid a necessary visit. I also want to mention that pumpkin seeds work best as part of a broader pattern, not in isolation. Reducing caffeine and alcohol in the evening, both of which irritate the bladder and worsen nighttime urination, makes a real difference alongside dietary changes like this. Staying physically active has also been linked to lower rates of BPH progression in several studies, likely tied to reduced inflammation and better hormone regulation overall. And managing weight matters too, since excess body fat is associated with higher levels of the hormone conversion I mentioned earlier, the one zinc helps limit. There's also a fluid timing piece that surprises a lot of men. It's not just how much you drink, but when front-loading fluids earlier in the day and tapering off in the few hours before bed can meaningfully reduce nighttime trips, independent of anything happening with the prostate itself. I've had patients make this one adjustment alone and see real improvement simply because they'd been drinking a large glass of water right before bed out of habit, not realizing it was working directly against them. None of this means you need to overhaul your entire life to see benefit. It means pumpkin seeds work better as one piece of a reasonable, consistent pattern, rather than a magic fix layered on top of habits working against you. One question I get constantly from patients is simple: how long before I actually notice something? And I think it's important to set honest expectations here, because so much of what gets promoted online promises overnight results that just aren't realistic for something working through nutrition and hormone regulation. Based on the clinical trials and what I've observed in my own patients, most men don't notice meaningful change in the first 2 to 3 weeks. That's normal, and it doesn't mean it isn't working. Phytosterols and zinc work by gradually shifting hormone activity and reducing inflammation in prostate tissue, not by instantly relaxing anything the way a prescription alpha blocker might. The men who saw real improvement in the studies were typically tracked over 8 to 12 weeks before researchers measured meaningful symptom score changes. I tell my patients to think of it less like taking an aspirin for a headache and more like the slow process of lowering cholesterol through diet. You don't feel your cholesterol drop day by day. You check in a few months later and see the number has genuinely shifted. Prostate symptoms work similarly. Track your nighttime bathroom trips in a simple notes app week by week, rather than judging night to night, because the improvement tends to show up as a trend, not a sudden switch. I also want to be upfront about who probably shouldn't rely primarily on this approach. Men who are already on medication for BPH, particularly certain hormone-related prescriptions, should talk to their doctor before adding a concentrated pumpkin seed extract, simply because some of the mechanisms overlap and your doctor needs the full picture to manage your treatment properly. This isn't a serious risk in most cases, but it's the kind of thing you mention at your next appointment rather than assume is automatically fine. Men with any known allergy to seeds or tree nuts obviously need to avoid this entirely, and there are other prostate-supportive nutrients worth discussing with your doctor instead, saw palmetto being one commonly researched alternative, though the evidence there is more mixed than what we see with pumpkin seed extract specifically. And I'll repeat this because it bears repeating. If your symptoms have escalated quickly, or you're seeing blood in your urine, or you're in real pain, this is not the moment for a dietary trial. That's a same-week doctor's visit, not a 3-month experiment. Something I want to leave you with because it applies far beyond just this topic. A lot of what circulates online about natural prostate remedies is wildly overstated, sometimes to sell a specific branded supplement at a significant markup. When you're researching this on your own, look for products or claims that reference actual clinical trial data, not just testimonials. A supplement company telling you their product cured someone's BPH is a red flag. A company citing a specific study, a specific dosage, and being honest about modest, incremental improvement is a much better sign that you're dealing with something grounded in real evidence rather than marketing. I'd also encourage you to bring this exact conversation to your own doctor or urologist, not because you need permission to eat pumpkin seeds, but because your specific situation, your current medications, your symptom severity, your overall health picture, all affect how much this kind of intervention is likely to help you specifically. What works well for one patient as a standalone approach might only be one small piece of the picture for another. While pumpkin seeds get most of the research attention specifically tied to prostate symptoms, I think it's worth understanding where they fit alongside a few other foods that show up repeatedly in this same conversation, because no single food operates in isolation inside your body. Brazil nuts, for instance, are exceptionally high in selenium, a trace mineral that's been studied for its antioxidant role in prostate tissue. Some research has suggested a connection between adequate selenium levels and lower oxidative stress in the prostate specifically, though the evidence here is genuinely more mixed than what we see with zinc and phytosterols. I mention it mainly because a lot of my patients ask about combining foods, and 1 or 2 Brazil nuts a few times a week alongside pumpkin seeds is a reasonable addition without any real downside, as long as you don't overdo it, since excessive selenium intake carries its own risks. Tomatoes and tomato-based products come up constantly too, specifically because of lycopene, a compound that's been studied fairly extensively in relation to prostate health. Cooked tomatoes in sauces or soups actually make lycopene more bioavailable than raw tomatoes, which surprises a lot of patients. This isn't directly related to the zinc and phytosterol mechanisms we've been discussing, but it represents another angle, working through antioxidant activity rather than hormone regulation. And there's some logic to combining approaches that hit the tissue from multiple directions rather than relying on one single food to do everything. Green tea has also shown up in a number of studies looking at prostate inflammation, largely due to a class of compounds called catechins. Again, the evidence isn't as strong or consistent as what we see with pumpkin seed extract specifically, but for a lot of my patients, swapping an evening coffee for green tea accomplishes 2 things at once: reducing a bladder irritant while adding a compound with some anti-inflammatory research behind it. I bring these up not to overwhelm you with a long shopping list, but because I want you to understand that pumpkin seeds work best as the anchor of a pattern, not as a single isolated fix you add once and forget about. The men in my practice who see the most meaningful, lasting improvement in urinary symptoms are almost always the ones who've built a handful of these habits into a normal week, rather than treating any single food as a magic bullet. I want to address something directly because I hear a version of this concern from patients constantly. A lot of men in their 70s and beyond assume that once BPH symptoms have been present for years, dietary changes are essentially pointless at that stage, that the tissue has already changed and there's nothing left to do beyond medication or a surgical procedure if things get bad enough. That assumption isn't accurate. Prostate tissue remains metabolically active and responsive to hormonal and inflammatory signals throughout a man's life. The mechanisms we've discussed, zinc's role in limiting DHT conversion, phytosterols' impact on urinary symptom scores, reduced inflammation from omega-3s and antioxidants, don't stop functioning simply because you've had symptoms for a decade already. Several of the clinical trials I mentioned earlier specifically included men with long-standing, established BPH, not just men in the earliest stages, and still found meaningful symptom improvement. I had a patient in his late 70s who'd been managing moderate BPH symptoms for well over 15 years, on medication the entire time, who assumed at his age there was nothing left to meaningfully improve. He added pumpkin seed extract alongside his existing prescription, purely at his own request after we discussed it, and reported a noticeable additional improvement in his nighttime symptoms within a couple of months, something his existing medication alone hadn't fully addressed. This doesn't mean it will work identically for every long-term patient, but it does mean that age and years of symptoms alone shouldn't be a reason to assume dietary intervention is no longer worth trying. Finally, I want to address the practical side of this because I've watched plenty of patients start out motivated and quietly stop within a few weeks, simply because they didn't build it into an actual routine. The men who stick with this long enough to see results tend to do one of a few simple things. They keep a small container of pumpkin seeds somewhere they'll actually see it daily, next to the coffee maker on the kitchen counter, rather than buried in a pantry. They pair it with something they're already doing every day, adding a handful to their existing morning oatmeal or afternoon snack, rather than treating it as a separate new task to remember. And if they've gone the supplement route, they keep it next to whatever other daily medication or vitamin they're already taking, so it becomes part of an existing habit rather than a new one they have to build from scratch. None of this is complicated, but the men who actually see the improvement described in the research are, without exception, the ones who kept doing it consistently for the full 2 to 3 months, not the ones who tried it for a week and gave up because nothing dramatic happened immediately. So here's what I want you to walk away with. Pumpkin seeds are inexpensive, easy to find, and backed by a real, if modest, body of research when it comes to supporting prostate health and easing BPH-related symptoms. They work through a few specific, well-understood mechanisms: concentrated zinc, phytosterols shown in clinical trials to improve urinary symptoms, and anti-inflammatory compounds that address one of the root drivers of prostate enlargement. They're not a miracle cure, and they don't replace regular screening or medical care. But if you're dealing with the frustrating symptoms so many men your age quietly deal with, and you haven't tried something this simple, it's worth a conversation with your doctor and a small addition to your daily routine. If this was useful, let me know in the comments whether you've dealt with any of these symptoms yourself. I'd love to know. And if you want more research-backed, honest conversations about men's health without the hype, subscribe so you don't miss the next one. I'll see you there.